Let me know when we are live.
And we are live.
All right. Well, good afternoon, everyone. Here we are again in our last Vaccine Oversight Workgroup. I want to congratulate the secretary for his newly confirmed and official position. And do want to reiterate thanks for the ongoing participation throughout this process. Of course, it has been, bumpy at times and hard because we are in the midst of something that is extremely complex and challenging. The good news is we're seeing significant progress. We saw that this weekend we had a record number. I think there were 74,000, I believe, somewhere in that neighborhood. And we are seeing continual increases. Looking forward to the update and then sort of where do we go from here at the end. Just want to kind of touch base on that component. But before we take up too much time, I want to hand it over to Mr. Powell for his update.
Thank you, Mr. President and work group. Jake, if you could put the PowerPoint up there and maybe, well, I'll start with this one. So this is where we are compared to where we were before vaccines were available. The testing is down 42%, number of positive cases down 57%, positivity rate down only 23% at this point. And if we look at the next slide, this is sort of the graph of the positivity rates. Since mid-December, you can see it got sort of to the lowest point at the beginning of March and has climbed since then. And so I'm going to spend a tiny bit more time today just sort of talking about what the public data says about new cases of coronavirus since the beginning of March. And if we can start with the next slide. So this is a map by zip code. Again, I wouldn't look too closely at one zip code because there's a lot of subtleties to this. But the larger the dot is, the more new cases in that zip code since the beginning of March. And the darker it is, the higher the case rate. I can tell you that Baltimore City, Harford County, and Baltimore County have the highest case rates in the state right now. The next slide zooms in on this a little bit. A little bit more detail of sort of the central Maryland, the Baltimore-Washington corridor. You can see like over in Kent County, there's a red dot. That's a small zip code with a high rate of new cases, but it is not a zip code that has a lot of people in it, so it's not a lot of cases. I hope that makes sense. Moving on to the next slide. Could we see slide 5?
I think we moved off of pointer. There it is.
There we go. So we wanted to look at the change in case rates by the different age cohorts. That gray line at the top is 20-somethings. They had the highest case rate. This is like per population at the beginning of March. That's grown and they're still the highest case rate. Those next cohorts are all sort of in line. The yellow is 30-somethings, the blue is 40-somethings, the green is 50-somethings, the orange are teenagers. And then those lower 4 lines with the lowest case rates are seniors and children 0 to 9. I do want to point out that the growth in case rates has been the greatest for the 0 to 9-year-olds for children. Next slide. Same thing, but by race and ethnicity. And I got to move something out of the way. Rates highest in the Black or African-American community right now. And that has been growing at a trajectory that we don't really see with other races or ethnicities. Next slide. The blue line is that positivity rate I've been talking about. The orange line is deaths. Deaths have remained low since the beginning of the month, even while the positivity rate has been going higher. Obviously, we hope that would continue, if not get even better. Next slide. Unfortunately, it doesn't show the same thing for hospitalizations. In this chart, the orange line is the daily hospitalization rate, and that has sort of begun to grow over the last couple of weeks. Next slide. Also growing the vaccination rate. I wouldn't read too much into the little dip at the end. Sometimes there's some data lag with the last couple of days, but continue growing at basically the same rate of growth that we've seen since the beginning, and hopefully that would continue or even escalate as well. Next slide. There's a little bit of confusion in the data this week. It looks like Maryland's reporting that we administered more doses that we've been distributed. That would be difficult if true. So we may want to look into that a little bit more. Next slide. Ratio of first to second doses, we're down to about 1 first dose for every second dose that we're giving out. So a few weeks ago, we were getting a lot more of our doses were being used as a first dose for people. Now that's less the case. Next slide.
Mr. Powell, on that slide, on that one, if it's a Johnson & Johnson, does it come in as the first dose or does it come in on a second dose?
It's a good question. We don't include it on this.
Okay.
It's a good question. Thank you.
Okay.
Next one. Maryland compared to other states, this one does take J&J into account. So the further you are on the right, the more people are fully vaccinated. The higher you are, the more people have had a first dose of a 2-dose vaccine. I think we're 19th in first doses and 24th in fully vaccinated. This is according to the CDC. Slight improvement, I think, from the previous week. Dramatic improvement since a month or 2 months ago. We are kind of right in the middle of the states in the US. Next slide. Also compared to other states, we're using about of all the doses we've been given, we use the ones we use puts us about in the middle of the states. That's an improvement from where we were back in late February, where we were sort of in the bottom tier. Next slide. Let's go on to the next one, and I'll go into some of these in a little bit more detail. The vaccination rate by race. The blue line is Asian Marylanders, gray is white Marylanders, orange is Black or African American Marylanders. Improvement for everyone, but still a disparity that continues to be exacerbated. Next slide. Same thing, but this is for people being fully vaccinated by race. Some pretty, I think, good improvement there for Asian Marylanders and Black or African American Marylanders. Next one. Same thing, but by ethnicity, first dose, pretty big gap between Hispanic or Latino Marylanders and non-Hispanic or Latinos. Next one. Same thing for ethnicity, but this is for getting fully vaccinated. And again, you can see that gap that we've seen since the beginning. Next one. We've shown this for the last couple of weeks. We want to get to 100% vaccination or as close to it as possible. That's the furthest to the right you could go on this. And the daily vaccination rate for 70-year-olds or those in their 70s has, kind of been heading downwards for a while. It's just getting harder and harder to find the people who haven't been vaccinated that hopefully want to. The next slide shows the same thing if we could for people in their 80s. So we're about 70% having gotten a first dose here, but that rate, the daily rate is getting lower and lower every day. Next slide. 8 largest counties, their daily vaccination rate. These are first doses again. Howard County, Montgomery County at the top, the blue lines and green lines. This I would look at more for the overall trend. You can see in the orange line on the bottom left, that was Prince George's County in the early days. We know that it was a struggle to do vaccinations there. Prince George's County over the last few weeks has been getting vaccinated at a rate that's comparable to some, if not most, of the other 8 largest counties in the state. Next slide, please. This shows that cumulative vaccination and some other data by the 8 largest counties. You can see Prince George is about 15% of the state's population, maybe 11% of the vaccines have been administered in Prince George's County. So I think that's an improvement from where we were a while ago, but still a bit of a disproportionately low number of vaccines. Next slide. Same thing for the other 16 jurisdictions in Maryland, and I'll point out maybe Washington County and Allegheny County, both of which have had fewer vaccinations than their like proportion of the population. And also 2 counties that struggled greatly with cases and deaths earlier this year, although at least in Allegheny County, that's not the case right now, I believe. Next slide. That's it for me. Thank you for your time. And if you have any questions, please let me know.
Well, thank you. And I'd be remiss, Mr. Powell, if I didn't thank you for all of your diligent work throughout this process, helping us. And I know that you plan to keep pulling these together at maybe not at a weekly rate, but maybe at the every other week rate that we will disseminate to senators so that we kind of can keep track of things. But do want to thank you for your dedicated work throughout this. It has been very, very much appreciated.
We'd be happy to. Thank you.
Excellent. Secretary Schrader, you are up.
Thank you, President Ferguson, and good afternoon, Senators. If I can get the first slide, I'll try and be as brief as possible so we can get into questions. I think Mr. Powell covered it very nicely. We're about to reach our 3 millionth shot today. And on Saturday, we did administer over 78,000 vaccinations. And we've now hit an average of about over 61,000. We've also got at least one shot to 41.7% of our 18 and older population. And we've administered at least one shot to 76.2% of our 65 and older population. I did want to mention in the chart that we're sending out, you'll notice in there, we've discovered that, and we're using CDC's numbers, but we also noticed that CDC has access to Marylanders who are in other states. And so about 37,000 Marylanders in other states, we don't know their names. We've been talking with the White House staff on 2 calls last week, and we've asked them, because I think it's going to be important for us to get access to those names, because right now we're at 228,000 that we're still trying to find. But as that number starts to drop, we don't know who those 37,000 are. So that'll be an important issue for us over the next couple of weeks. As of this morning, we had 448,000 Marylanders 16 and older who have pre-registered for an appointment at one of the 6 mass vac sites. And when they pre-registered, they were given the option to choose their top 2 preferred sites. As you know, the governor's holding a press conference as we speak. So just wanted to say, what he's announcing is that tomorrow, all Marylanders over 16 will be eligible to be vaccinated at a state mass vaccination site. So that we're accelerating the pace based on our capacity and supply and our interpretation of demand. All other providers will have until next Monday, the 12th, to open to all eligible Marylanders, and we'll have the ability to continue to prioritize earlier groups. So we're still going to ask them to do 65 and over first, those with comorbidities. But if somebody comes in and they have shots and they don't have them, they'll be able to administer the vaccine. The other thing we've done last week late is we added a walk-up lane, no appointment, to the Wycomico Civic Center, and we administered more than 500 vaccinations on the first day that we offered this option. So we're going to move next to Hagerstown tomorrow to open up walk-up, no appointments, and then next week we're going to move that to M&T Bank Stadium. So we'll be monitoring this to the degree it's successful. We'll continue doing it. Next slide, please. As I mentioned, we're laser focused on 65 plus. We now have fully vaccinated 52% of them. I already mentioned about the 228,000. And as a component of our senior strategy, the push-pull that I talk about, the pull part is we now have our 3rd week of our primary care practice program. You may recall we started with 37, and they were largely based on their connection to African-American and Hispanic communities and their locations in areas with less geographic access. We now have this week 155 practices in that program, and all of the new practices have the same criteria, but also added our 65 and over population. So we're going to continue driving this. Next slide, please. Senator Roosevelt, I wanted to thank him for joining me at Mary's Center in Adelphi on Saturday. We were able to see the end result of how we are putting shots into arms in targeted zip codes and hard to reach minority communities. I also appreciate Senator Augustine was there with Delegates Fisher and Pena Melnick joining us. And there was a line out the door very similar, President Ferguson, to what we saw at Sacred Heart. So that was very, very encouraging. You'll probably notice in today's summary report that we actually, for the first time, hit 20% African-American population receiving shots. We just hit 4% for Hispanic, and we need to get to 9 or 10. So we're really putting a lot of pressure. We're making steady incremental progress within the African-American community, but we need to make much quicker progress in the Hispanic community. I also wanted to mention that Mary's Center is a federally qualified health center that we've been giving doses to. They serve over 60,000 people of all incomes and backgrounds, and they're in one of our targeted underserved zip code 20783. Also on Saturday, Dr. Elliott, the Mary Center Chief Medical Officer, and his team, they administered 200 vaccines. And this was in partnership with the Vaccine Equity Task Force, and the National Guard team was on hand to provide support. And none of this would have been possible without Mary Center contacting. They called their clients to bring them in, and because they're trusted in the community, they were able to get them there. Dr. Elliott also told us that getting vaccinated, he felt it was his duty as a physician and set the example for the populations that they serve at Mary Center. And he's quite remarkable, selfless, unsung hero in this whole process. If I go to the next slide, please. Also on Saturday, I attended the opening of the new COVID-19 testing site and antibody treatment center at the City of Praise Family Ministries in Landover with the Lieutenant Governor, General Burkhead. And we had officials from the U.S. Department of Health and Human Services, Bishop Joel and Pastor Wanda Peebles of City of Praise, renovated part of their former church school, and it's now set up to help us. And you can see in the background the testing area. This is really important because as we continue to say to folks, we need to continue testing. We need to continue to use monoclonal antibodies. And so it's really important that we continue the testing effort, and it's one of our 4 pillars. Next slide, please. And I'll close here quickly. On Thursday, we were at MEMA to see one of the nation's first mobile vaccination units that we're going to be deploying around the states to remote and underserved areas. There's 2 30-foot trailers. They include cold storage, as you can see. They've got redundant power with generators, and they're adding to our vaccine fleet. And each one of these FEMA units can provide 250 shots a day, and appointments can be booked through the health department in the individual's county of residence. And the schedules are going to vary depending on need, and it's a nice fit into our overall strategy. Let me just quickly conclude by saying these are just a few examples of what we're doing to vaccinate as quickly and equitably as possible. I'll stop there, Senators. I look forward to your questions.
Thank you so much, Mr. Secretary. And we will have, I know Education, Health, Environmental Affairs does have a voting session at 4:30. The last week of session, there are 7 things scheduled at the same time. So I will ask a couple questions, and then we'll go to Senators Washington and Lamb, who will have to leave at 4:30, I believe. Then we'll go to Senator Eckert, Young, and Rosapep. I wanted to sort of start on this, on the pre-registration. You said that there were 416,000. Is that right? Is that
448,000.
448,000. And any trends from where? I mean, is it sort of yes, I don't even know the right way to say it. Does it are people pre-registering at the rates you would expect from the state as a whole, or do you see any trends in the pre-registrations?
So far, we feel pretty good about it, but I'm gonna be watching it very carefully. We're in a critical period. I'd say the next 2 weeks will tell us a lot of information. We're opening this thing wide open. We expect to see a growth, and I wouldn't be surprised if it goes to 600, 700, 800,000. If it plateaus, then we've got a different situation. So it's too soon to tell, but I'm gratified by the 448,000 we opened up last week to 2B. We got 2C coming up here, and then of course the governor is just announcing, as I mentioned, that because last week we opened it up to anybody that was interested in the vaccine. So anyway.
Okay. The two other short things that in the increased positivity rate that we've seen, do we have any knowledge of whether this is variant spread? Is that something that we're tracking or monitoring, or is that something that we don't necessarily have the full?
Well, we think a lot of it is due to the UK variant. I will say that 75% of the cases are 18 to 64. The good news is that only 9% is 65 plus. Which is why we're in this race to vaccinate as many people as possible. The other thing we're finding is the use of ICU beds is flat. It's gone up some, but it's not, the most of the growth is in med surge beds in the hospitals, and they're younger people, so their length of stay is down around 6 days. So we're, we got our fingers crossed. But the next big push is, as we get this new supply and we open it up, is to vaccinate as many young people as possible to hopefully break the back of the virus.
Great. My last question is, and if we run out of time, I just want to, maybe I'll turn at the end. I've been sort of thinking, okay, what is this sort of the next phase? And the big next phase is, I would imagine, fall school reopening. So kind of August. Is that something that you've started thinking through? I mean, assume vaccinations for the most part. From your perspective, do you foresee a regular reopening of schools?
The governor said that he wants us back to normal by Memorial Day. So he's pushing us like crazy to get this vaccination process done. What I'm thinking about beyond the schools is the decay rate of the vaccine effectiveness. Right. And then when does that come in? And then when do we start looking at booster shots? I think that's I think we should be ready to go back to school. And we have a very robust testing program. Testing that we're doing in Prince George's County came about because we had done such a massive use of our BioNext Now tests that we gave to all the school systems in the state, that HHS Region 3 heard about it. They called us, and they had a relationship with KPMG, and because we have a contract with KPMG, we found out that they were doing this monoclonal antibody. So that's how we got that set up. So, but getting back to your original question about the schools, I think we're pushing regular testing, and I expect that the fall should be as normal as can be. But I think the next big questions are going to be about the decay of the vaccine. There are other people that would argue that immunity is really the big test. So we're talking about that too. So more to come on that.
Great. Well, thank you. Well, we'll go to Senator Washington. I know it may be shorter. I'm sorry for the vote.
It's okay. It's okay. Again, congratulations, Secretary Schrader, on your confirmation by the Senate. And I've enjoyed these discussions we've had. Great that we could be a part of this process. There's been tremendous improvement, and I think we are being good partners. And I hope you see us as good, reliable partners in your efforts going forward. I also really do appreciate, you're reaching out to me to identify, kind of in response to my comments last week about identifying local partners and making sure that we have diversity and inclusion specialists. So I'm looking forward to following up with you on that. Also, we talked about, focusing, and when you looked on that map of hotspots, my district, the 43rd district, Northeast Baltimore, all of Baltimore, but certainly in my district, we've got a lot of high rises, we've got senior centers, public housing. I know that the Assistant Secretary is in the process, I believe, in reaching out to some community association presidents and community organizations, in the district. I believe that that's correct, right? We're starting that process.
When you say the assistant, sorry, you're talking about.
Sorry.
Oh, yes, exactly. Yeah, no, that's
you probably
right.
have lots of them.
I wanted to make sure I knew. We're doing a lot of work in Baltimore. We're actually seeing the numbers improve pretty well. It's not where it needs to be yet, but we're up around 24-25%. And the activity, matter of fact, I just looked at the numbers from last week. The convention center is now doing 81% Baltimore City residents, and 16% of the vaccinations were in the 6 zip codes that we targeted. So
right.
That process seems to be having an effect. So we want to reach in as much as we can. Yes. Right.
And moving up into 21218, 21212, 21239.
Yep.
And also you're seeing, I'm happy to see my colleagues out there working with you, and you're seeing that we as senators can be partners. I do have an issue with the home visit program. Did help with a particular, Mr. President, we had a constituent as a 102-year-old woman. My constituent reached out to me on behalf of his mother, who was 102. She was part of the home visit program. He had been trying for a couple of weeks to get his mother vaccinated because you cannot move her. If you moved her, that would be a great risk. And he was told for a couple of weeks that the home visit program didn't yet have vaccine. Now, I know as of Friday, Mr. Yee said that we were able to get a specific vaccine for my constituent, but I'm wondering about the broader issue. Do home visit programs now have access to the vaccine for our most vulnerable seniors?
Yeah, I've been pushing on our vaccine planning team to get homebound seniors in particular. So that's one of the target populations, and we're recruiting home care agencies that would be willing, and we particularly want to use the Johnson & Johnson so they don't have to go back a second time. So that process is underway.
Okay, so just to be clear, Mr. President and Mr. Secretary, that there are already home visit programs, so there's really not the need to contract out with some other provider. There's already home visit programs that are associated with hospitals, MedStar, Hopkins, a number, Baltimore City Health Department. If we could work on those, so if we could target those existing home visit programs with their existing caregivers, is that what we're going to focus on in the next?
Yeah, we've directed the local health departments and the hospitals to go in, use because we're giving them doses, and they're getting a fair amount of doses. We expect them to go and find the elderly population that are homebound and go in and use their resources to get those doses done. So yeah, there's nothing standing in their way from doing that.
Okay, well, thank you. I'll follow up because they're reporting that they didn't get doses as of 2 weeks ago. So it sounds like it's moving along. Thank you, Mr. Secretary. Looking forward to working with you.
You're welcome. Thank you.
Senator Lamb.
Thank you, Mr. President. I wanted to dovetail on what Mr. Powell had presented just a few minutes earlier. And Ms. Schrader, you're probably aware of some of these numbers too, that we saw 67 hospitalizations yesterday, the highest since January 6th. Also yesterday, we had almost 1,700 new cases, the highest since January 31st. Maryland hasn't reported consecutive days of fewer than 1,000 new confirmed daily cases since March 22nd and 23rd. And as was pointed out earlier, the highest rate of new cases is actually amongst the 20-year-olds, followed by 30s, 40s, 50s, and then teens. And the highest growth rate in new cases since March 1st has actually been in children aged 0 to 9. Hospitalizations now are trending upward. And this could very well be followed by deaths, because we know that deaths is a lagging indicator. Why do you think the lower age groups are now showing a rapidly rising number of cases, and what are you doing about the younger individuals in these populations?
Well, we're thinking that because the variant spreads quicker, the transmissibility of particularly the UK variant moves faster, that it seems to be affecting these age groups more. But as I said earlier, we're also tracking on the length of stay. And the length of stay is very low relative to, it's about half of what it was when we saw a larger part of the population. The seniors are, 11, 12, 14 days.
Do you think it's all because these younger populations are more mobile, they're out more, they're at bars and restaurants more frequently? Do you think that's why these younger age ranges are seeing a rapidly rising increase in the spread, as well as schools?
Well, it's clear that younger people are, in this regard, are much more, what would you call it, mobile. They're out and about. But I think seniors and folks that are older understand their risk, and they're being more careful. We're telling.
I'm talking about the younger age range.
No, I know. But I think you're right. I think, younger people feel like they're indestructible oftentimes. And that's going to be where we have to really go after the vaccinated.
Right.
We got to get the younger population vaccinated.
So aside from increasing the age range to include the younger folks, which I agree is important and is needed, what are some of the specific steps the department's undertaking to address the rising number of cases and positivity rate, particularly amongst the younger population?
We're continuing the wearing of masks, social distancing, and encouraging people to wash their hands. It's pretty straightforward, I believe.
Okay. I am concerned that that's not anything new. We have seen a new trend, which is a rising rate amongst the younger population. And what you're conveying is basically what we've conveyed as good public health measures since the very beginning of this pandemic. So I would urge that you take a closer look at that. Over the weekend, Jane Miller of WBAL had cited the fact that since the Vaccine Equity Task Force has been created, over the last month, the vaccination rate amongst Black Marylanders is still significantly less than the proportion of the population that they are. The difference between white and Black Marylanders has also increased. In January, there was a 44.9% difference in the vaccination rates between white and Black Marylanders. Now there's a 48% difference, and the difference between white and Black Marylanders in the population is only 27.4%. So why do you believe we're not seeing improvements in the vaccination rate of the Black population here in the state?
Well, number one, I'm not sure. The data I have, even as early as this morning, shows 20% of the Black population having fully vaccinated, second and single doses, which is the first time it's broken through 20%. Now, I'm hoping that'll remain that way. And the white population is down around 64.8. So it's been dropping about 3 percentage points over the last 2 or 3 weeks. So I think a number of the interventions that we're making in the more vulnerable communities is helping us drive that number up. We need to get to about 29 or 30%, but we're inching along and making steady progress.
Yeah, I am concerned about this because it does seem like, at least based on the numbers that have been put out there, that since the Vaccine Equity Task Force was created, the difference there is actually widened since the inception of the task force. And I think, that means that white Marylanders are still being vaccinated at a higher rate than Black Marylanders. Black Marylanders are doing better, as some of the numbers that you cite are accurate, but the rate at which white Marylanders are being vaccinated is still higher. And then the last population I want to touch on is...
We have to move along, I'm sorry.
Okay.
We're out of time. I'm sorry, Senator. Senator Eckert.
Thank you very much. And Secretary Schrader, congratulations. Thank you for opening up that walk-in in Salisbury on your way to Ocean City. That was brilliant. There was a lot of traffic down in Ocean City, but the questions I'm getting are now, as you said, will we need a booster? How long will this vaccine last? So I think some of those questions moving forward are really important as we continue to get the vaccine out to our other vulnerable populations on the shore. We're at a little bit of an advantage because we're spread out rural areas that are not being vaccinated. And I know there's a yeoman's effort through Walmart, through CVS, through our private primary care practices. And if you would continue to look through those home care agencies, that would be an excellent way to also reach people who are able to get out. So keep up that good work.
That's
Thank
a
you,
very
Mr.
valid
President.
point, Senator. And I'm gonna make sure that we start to put more pressure on that. There's a number of things we're doing for seniors, but I think getting home health agencies, but I think as the other senator mentioned that some of these home health agencies are already affiliated with hospitals, et cetera. And we and local health departments, we're pushing, as we push doses out, we're in our bulletins, we're asking those organizations to use every avenue they have, including home health. I don't want to recreate the wheel. Sure.
Right. And I know our senior centers have been very thrilled and they're very public about getting vaccinated and getting all their folks on board. So thank you for that.
Thank you, Senator. On to Senator Young.
Yes, thank you, Mr. President. With the rate going up in Maryland, what is the governor doing to curb that? And are you looking at the counties where it's happening and how that relates to what they're doing in those particular counties? And are you going to use that fact in any way in terms of distribution of vaccines in the future?
Yeah. So I think part of two thoughts, Senator Young. I think it was a week ago when we analyzed the data, it became clear that Baltimore County and Baltimore City were rising faster than other jurisdictions. And we pushed to get a lot more primary care physicians vaccine in those areas. And then, of course, the whole idea of why we're accelerating the younger people to get vaccinated is the data tells us that we got to get young people vaccinated faster, and so that we can break the back of this pandemic. And we think that's a strategy that's going to get us there, which is why. So we were accelerating the process of getting vaccine to younger people.
Well, but have you seen a tie between the regulations or what each county is doing and where the rate is going up?
Yeah, Senator, I don't know the answer to that question. Let me take that back. And obviously we rely on the local health officers, but we'll bring that back and get back to you on that. That's okay.
What kind of have you gotten any signal from the government as to how much vaccine you're going to be getting in the upcoming weeks? Is it still going to increase or increase drastically, I hope?
Well, we expect that. I mean, it didn't increase as fast as we thought this week. But they can, but we did see a major jump in J&J from like 34,000 the week before to 88,000 this week. So that's a good sign. We're expecting a much larger jump of Pfizer and Moderna to start. Moderna has actually announced that they're going to push more doses into their vials. So we're expecting that will help increase the amount of vaccine. So we're somewhere in the 300,000 zone this week, and we expect to get up over 400,000 very soon. So here's the chart. You can see this week we're in the 372,000 zone. We're anticipating in the month of May getting up over 500,000, and we'll be able to push those doses out through our capacity. The only other thing I'll mention about this, what's not included here is the federal government is pushing over 100,000 doses a week to the pharmacies around the state. We don't have good visibility on that. I think there was a question that there was a graph that Mr. Powell showed earlier. And what's driving that overlap between the green and the orange is the fact that there's a lot of federal doses coming into the state and being administered through programs like the pharmacies, and that makes it. And we're only counting the doses that we receive, so there is a little overlap there.
Okay, I just wanted to say congratulations too, and I appreciate you working with us the way you have.
Thank you, Senator Young. Thank you very much.
Thank you, Senator. Senator Roosevelt.
Thank you, Mr. President, and same here. Congratulations, Mr. Secretary, and thank you very much for coming out to Prince George's on Saturday with us and with the opening of the Mary Center. I think over time it's been the hardest hit zip code. It's a heavily Latino area of the county, and they need a lot of help. So thank you for doing that. Two sort of unrelated but somewhat related questions. If you think we're going to get 500,000 doses a week, the state to allocate. On top of that, you'll have what the federal government's doing to the pharmacies. Help me relate that to the demand, because if the governor is opening up the spigots for anybody now over 16 or over 18 is eligible, everyone's going to think they're going to be able to get a dose. And that's what created all the confusion over the last several months is the governor says everybody can get a dose, but everybody couldn't get a dose. So,
yeah.
So managing supply and demand.
Yeah. So as you recall, we're actually asking people to still pre-register to get appointments. We're going to do this walk up at the mass vac sites, but the pre-registration system that we built at your urging is going to help us manage that demand, because we still are going to prioritize people 65 and older and 60 and over and 55 next week on the, as we've been building this up.
And I appreciate that, and I agree with that. But this is the first time I've heard of the walk-up sites. When you have a walk-up site, isn't everybody going to drive from all over the state to walk up and get in a big line?
We don't think so. We're not sure, but particularly that's why we're going slow. Wycomico had the capacity, so we offered it. There were about 500 people that showed up. Tomorrow we're going to do Hagerstown, and then next week M&T. So we just want to see how it works. But we're still urging people to pre-register and get an appointment.
No, I understand, which I think is appropriate. But looking at it from the citizen side of it, what should we be telling our constituents about if you're 40 years old, you don't have a pre-existing condition, sign up online. When are you likely to be able to get a vaccination? Like 2 months from now, 3 months from now, 2 weeks from now? What expectations should we share with our constituents?
Well, what we're finding is that the turnaround time for somebody who signs up and is eligible is pretty quick right now. I mean, we're talking to a lot of people that They sign up and they're getting an appointment the next day. They're getting a call.
Right, but the governor's opening it up to everybody now, and you're telling me that it's
True.
my 40-year-old person without a pre-existing condition is not prioritized. So they're unlikely to get a call saying, show up tomorrow, right?
The reason we're doing this is we want to see what happens. We think that we don't want to see. We want to make sure we use all of the capacity we've built at these mass vac sites, because we're churning out thousands of people. And as I mentioned, with the younger population now being the target of the what do you call it? The target of the problem, we really want to get them vaccinated as fast as possible.
I understand. Well, apropos of that, I want to make another pitch that you and I discussed before.
Sure.
Get vaccines to our college campuses. We have a high concentration of young people in College Park, for example. I know there are other colleges that are important.
Yep.
If they can get the vaccines, they can vaccinate tens of thousands of young people before the kids leave for the semester.
No, that's a great point.
Young people.
Just so you'll know, we've been working with the campuses through Secretary Fielder. We have 54,000 students that have been identified, and our objective, we're working with each campus, and our objective is to get those kids vaccinated before they leave school.
Great. I think that's an incredibly important goal.
And that's going on as we speak.
Terrific.
Planning for that, working with the campuses.
Coming back to my one note wonder of Prince George's County.
Yes.
You're identifying the zip codes that are priorities. I appreciate you're identifying the numbers we need to get up to the average. I come back to the question I keep asking. When do you think we will have a plan that will say, okay, this number of doses, this number of people being shots in arms, this number of locations to get Prince George's? We're still the back of the pack. Charles and Prince George's are still way below the rest of the state in terms of percentage of the population vaccinated. When do you think we can actually have a written down plan with visibility so everyone can see, here's how we're going to do it?
Right. So, at your urging, we started that, and last week we started doing the calculations. It's become very clear that Prince George's is about 50 to 60,000 doses behind. And even though they now are at a steady state comparable, we have to catch up.
Right.
So one of our thoughts is that with the Greenbelt 21,000 a week, we're hoping that will catch it up within 2 or 3 weeks, but we have to do other things. Glen Arden is looking at doubling the amount of vaccines they're doing. So right now, the key is we got to make up 50 to 60,000 doses and maintain our current.
I'll look forward to continuing to work on that, Mr. Secretary. Thank you very, very much.
Yes, sir. Thank you, Senator.
All right. Thank you, Senator. Well, look, we are coming to a close here. Wanted to end on sort of a point of where do we go from here? The Senate has moved forward, Senator Rosapep and a number of senators who are co-sponsors on bill related to the vaccine plan and the ongoing work moving forward. We know that the health department has provided some very helpful insight into that moving forward. That is certainly a marker that I think we'll be watching very closely. Certainly every senator in their own district will be monitoring the ongoing vaccine distribution regularly and look forward to ongoing collaboration with the department and on these issues and the many others. And we do look forward to following up in about a month from now with this group or potentially similar group to check in on the status. I would say it's sort of like a football game where we had a tough, nervous first quarter. Our second quarter is showing great results. We've hit halftime and we've got the second half of the game left to play. We have every confidence that we can get there, and we stand ready and willing to partner to make sure that it gets done because there's nothing more important than it being so.
Well, I look forward to it, Mr. President. We plan to continue to send the daily reports that you're
Excellent,
getting.
please.
Thank you.
Yeah,
I was
so
gonna ask
you'll
that too.
have
Thank
that. We'll get that out to you every morning to all your members. And then if there are follow-ups like you mentioned, I think that would be perfectly doable.
Wonderful. Excellent. Well, thank you, members. Thank you for your time every Monday. I know it's always tough. Thank you, Mr. Secretary. I know that there were Mondays were tough in the midst of this, but I do think it was helpful to get information out throughout this process. And I think Marylanders have benefited, which is ultimately why we're all here. So thank you. Stay safe. Let's get it done. Thank you.
Yes, sir. Thanks, Mr. President. Take care. Bye now.
Thank you.